Hello everybody, welcome to this next edition of Ask the Expert on localinterviews.tv. Today we're going to be talking to Dr. Andres Gantus, a facial plastic surgeon from Toronto, who's actually a leading rhinoplasty surgeon in the country. So thank you very much, Dr. Gantus, for joining us today.
Pleasure, Eric.
Great. So let me do this. We've got a few questions from some of our viewers, and well, I'm going to start with the first one, which is pretty obvious, but what is rhinoplasty? Just that we are on the same wavelength.
Yeah, rhinoplasty is just a series of surgical procedures that allow us to modify the nose. That's what the word means and what the operation really is. It's an operation, sort of different operations that allow us to change the shape, the size, and the function of a nose.
Okay, that makes sense. Now let me see. We got a question here from Mary. How old must I be to undergo rhinoplasty, and is there a maximum age limit?
Yeah, that's a great question. Rhinoplasty is a procedure that we do in a lot of young people, and often we have very young patients that wish to have a rhinoplasty, and we have to advise them to wait until they're a little bit older before they can have it done. In general, the nose stops growing in women by the age of between 18 and 20, and in men, 21 to 23, it is thought. But we can definitely operate on girls by the age of 16, 17 quite safely, and in men about the age of 17, 18, depending on the degree of physical development. And that's more or less standard for across the board. In terms of age limit, there's really no age limit. It will vary depending on what you do. It would be very strange to do a cosmetic rhinoplasty in somebody in their 80s, where you're changing and modifying the nose at that age, but not uncommon to do a functional operation where you're trying to improve function and make their breathing better and the work of their nose better. So there's no age limit if the patient is healthy enough to have surgery.
Okay, great. Now I got one that's a bit complicated. Let me just try to read this. I've heard there are two types of rhinoplasty, open and close. Obviously, this person did her homework. I want the best possible outcome, but I don't want an unnecessary scar. Which type of rhinoplasty is the right one for me?
Well, I mean, that's a good question. Indeed, there are the two different types, the endonasal or closed approach, or the external or open approach are the two ways of doing rhinoplasty. The endonasal or closed approach has scars and it has incisions, but they're all done on the inside of the nose. It's the more traditional old way of doing rhinoplasty, and it's a good way, and in some hands it's a fantastic way of doing surgery. You are limited, though, however, by exposure and by being able to see the structures and modify the structures as well as one could through an open approach. The open approach has gained a lot of popularity since it was introduced in the 70s by one of our Toronto surgeons, and it's now a worldwide recognized procedure as well. The advantage of this procedure is that it allows us to modify things directly, to work on the tissues and the cartilages and the bones directly, and it's a very good procedure. Which one is best for you depends on what you need to have done and what your surgeon does. Some surgeons are very comfortable with open approaches. Some surgeons are very comfortable with closed approaches. It doesn't mean that you're going to have a better or a worse operation. The scar is inconsequential. The little cut that is made on the outside part of the nose, it's invisible in 6 months in 99% of patients. So it's really not an issue that one has to be worried about.
That's great. Here's a more practical one. How long will I be out of work following rhinoplasty?
Yeah, in general, I tell patients that they should take about 2 weeks off. Some people don't want to take that much time, and I tell them in that case, the first week they're going to be on some painkillers, they're going to be recovering from the anesthetic and the surgical effects of surgery, they'll feel a bit tired. If they want to work from home, they don't mind their colleagues seeing them with a little bit of bruising or a cast on their nose, they can go into work, I don't mind, as long as they're not exerting themselves. But in general, I would say about 2 weeks before you're presentable that most people wouldn't know that something was done.
Okay, sounds great. Got a few, but I got one of my own. I mean, I've done a bit of research myself just before this interview, and I kept coming across reconstructive and cosmetic and functional. And can you clarify that for us?
Sure. Cosmetic operation obviously is when we're trying to change the shape of the nose, either to make it smaller in most cases, or in some cases to make it a little bit bigger and more defined. It's a procedure that has basically just a cosmetic appeal where we're really just modifying the external aspect of the nose. A functional operation is something where the patient has breathing issues, respiratory problems, or other issues such as that, where we're trying to modify the nose in order to improve that. And a reconstructive rhinoplasty is usually functional as well, but it usually means that there has been either an accident or a previous operation or some injury, either by disease or previous surgery, that needs to be fixed in order to make the nose look better and work better.
Oh, okay, that's great. Now I understand better. Now there's a question that's I think that's a very interesting question too. I believe it's when and why are grafts or implants used?
So yeah, that's a good question. A graft is when we take tissue from our own bodies and put it back in a different part of our body. An implant is a synthetic material that is placed into the body. That's the big difference between the two of them. Grafts in rhinoplasty are very common. We use grafts in order to restructure the nose, to rebuild it. We use grafts in order to change the shape of the nose, to camouflage parts, or to make some parts of the nose look a little bit better. So that's what we call a visible graft versus an invisible graft, which is a structural graft that you can't see but adds function. Implants are used in some parts of the world and by some surgeons in order to do the same, to modify the nose. I personally don't use implants because they tend to get infected or come out or give problems even 20, 25, 30 years later. And so I don't like using anything foreign in the nose. But the reason for the graft or the implant is to modify the shape of the nose and to add a little bit to it at times.
Okay, that sounds good. One question that keeps popping up is the one about costs. Can you talk about costs a little bit with us?
Well, the cost obviously will vary. In Canada, we have national healthcare system, and functional and reconstructive rhinoplasty, by and far, is mostly covered by our insurance system, with very few exceptions. So there's no cost to the patient in those cases. Cosmetic rhinoplasty, on the other hand, is never covered by any insurance plan, and the cost will vary on the geographical location of where this is being done. So different parts of the country will have different costs. In Toronto, that I can talk, I would say that the average cost of a rhinoplasty performed by a good rhinoplasty surgeon will vary depending on the operation. I would say between $6,000 and $9,000, everything included. Obviously, that would include hospital and anesthesia and facility fees and so on. It can be higher than that in some cases where a lot of work needs to be done or there are revisions, but usually nothing less than that, I would think, in experienced hands.
Okay. You mentioned something that I found interesting and I believe is important to our viewers. You mentioned a good rhinoplasty surgeon. So first, I'd like you to talk to us what's a good rhinoplasty surgeon. I mean, how can people figure out if they are good or not? And I'd like you to talk about yourself a little bit, just that we understand a bit more why you're such a leading rhinoplasty surgeon in the country, if not the world.
Yeah, thanks, Eric. The choice of a surgeon is always difficult for anything we do. Rhinoplasty is a very complex operation. Pretty much of all the cosmetic operations that are done on the face or the body, it's probably the most complex operation. There's a lot of variables, there's a lot of steps to doing it, and it's hard to learn how to do this well. So choosing a proper surgeon means choosing somebody who has had a lot of experience with this, that has the proper training, both in the functional part of the operation and in the cosmetic part of the operation. Normally, I would suggest that the patient ask the surgeon, how many rhinoplasties they perform a year, to look at some results. In the office, you can see photographs and so on of previous patients. Sometimes patients will have, or doctors will have, some comments from other patients online or in books in the office where people write notes, thank you notes, and so on. And that gives the patient a good idea as to what the surgeon does. Obviously, consulting with your family doctor or with somebody else who has done helps in choosing somebody. But in general, you will have either otolaryngologists, head and neck surgeons that do facial plastic surgery, that are perfectly trained to do the operation because it's their natural field, and general plastic surgeons that have an interest in rhinoplasty that also do a very good job. Talking about me, well, rhinoplasty is one of my passions. It's something that I have been completely and terribly interested since early in my training. And I have developed an interest, a lifelong interest in perfecting my techniques. I have introduced several techniques and have probably the largest experience using rib grafts in rhinoplasty for reconstruction of very severe defects, which are very complex operations and incredibly rewarding operations, helping people regain function and regain self-esteem. It becomes just a matter of pride and experience after being in practice for 19 years and doing hundreds of these operations every year that has made me more competent in this operation than a lot of other people. At least I would like to think so.
Well, there's one last comment about this. You mentioned in your reply that consulting their general doctor or their MD, their family doctor, but also I guess consulting you. Do you offer some kind of a consultation that people can sit down with you and see if you guys are a fit? And then
absolutely. I mean, the first step to any operation is the visit with the doctor, the consultation visit. That's where we can learn what the patient wants, what the problems are. We can examine the patient, we can assess the function of the nose and the cosmesis and the way the nose looks, and make a decision as to what can be done, and we can offer the patient a surgical plan. The patient at that point has the chance to see whether they like the surgeon and whether there's a good fit between patient and doctor. It's not something that is a given thing. Sometimes there are patients that as a doctor we don't like and we don't want to take on. And many times the opposite is very true. The patient does not like the doctor. They may think they're arrogant or not knowledgeable or not caring enough. And that's something that happens to everybody who's in practice. So it's important during this consultation process to get a feel, develop a doctor-patient relationship, and decide whether this is going to work long-term.
Well, thanks for your honesty first. So it's very appreciated, and I think our viewers will appreciate it. So I'd like to end this by thanking you very, very much for taking this time with us to explain to us what rhinoplasty is. And I would invite our viewers to actually contact you if they have any questions, and if they want to set up some kind of a consultation. They saw your number, I believe, so I'm just going to go back just to make sure people see your number. It's 647-560-0800 is a number they can contact you at to set up a meeting. And there's always the website itself where they can send you an email to get some kind of a consultation with you. So once again, a big thank you for your time, Dr. Gantos. So I hope that some of the viewers have a chance to contact you, and that you can get to help them out.
Thank you, Eric. I appreciate your help as well.
Perfect. So thank you, everybody. That's it for today's edition of Ask the Expert with Dr. Andres Gandus, the facial plastic surgeon from Toronto, that helped us understand more what rhinoplasty is all about. So once again, you can access his website or contact him directly to set up a consultation, a free consultation. And so that's it. So talk to you later, everybody. Bye-bye.